And now the main news in detail. Workers under the COVID-19 community sensitization project run by the Ministry of Health have demanded payments for various works conducted, stating that none of them have been paid, despite them having completed their delegated work. In an interview, the workers who are from Lusaka's Kamwala South explained that they were engaged in March of 2022 to conduct community sensitization on COVID-19 and polio, as well as administering COVID-19 jabs at 100 kwacha for each day of work conducted, but were never paid any single day's work. Meanwhile, Kamwala Ward 5 Councillor Mr. Mainda Simata, who accompanied the workers to Chawama Level 1 Hospital, where they were engaged, says the delay is surprising as funding for the project was already given by the international community. When contacted for a comment, management at the hospital has called for patience, citing bureaucratic procedures in payments.
These are community COVID-19 workers from Lusaka's Kamwala South who stormed Chawama Level 1 Hospital in Lusaka on Friday, demanding their pay for their work done, which included sensitizing community members on COVID-19, as well as administering the COVID-19 vaccine. The over 25 aggrieved workers explained that they were engaged at Chawama Level 1 Hospital in March of 2022 on different programs, but all under the Community Sensitization Project, which falls under the Ministry of Health, with funding from the international community. They explained that their work also involved community sensitization on polio and say it was agreed on that they will be paid 100 kwacha for each day of work, but state that none of those from Kamwala South have been paid to date.
Been following up, so we do not know who is sitting on these papers and why they are not actually paying us up to date. And going back to polio, in the first round, which was in March, up to date, no one has been paid.
Ama papers ngatwaleta kuno. Ama paper yonse kuluba ku office kuli ba coordinator, ngafyaisa kuli accountant ifyaluba, ngafya futi ifyaluba. But Tuesday twali kuno ama papers zeko yaje. Yesterday, that is Tuesday la week. Yesterday kuisa kuno ama paper takunti. Na filuba. Amwe ba accountant tamundi ku checking am computer. Takwa barangu di mweshino wa Kamwala South di mu computer. Yama ko vale ngisha mashino kuma ku banki. So
meanwhile, Kamwala Ward 5 Councillor Mr. Mainda Simata, who accompanied them, says there is no reason for the delayments, as they were informed before engagement that money was readily available.
They are giving stories that money or the sheets for them to be paid were sent to the bank, but up to now payments haven't come. What I found out again is that the district health director, Mr. Mwale, who I spoke to, assured me last week to say that these people were going to be paid through mobile money accounts. But after coming here, the story changes to say, no, they're supposed to be paid through bank accounts. They submit those bank accounts. Again, we are here from the accountant to say, no, those papers were missing or they haven't been submitted to the bank. So my feeling as a civic leader is that there is something terribly wrong at this district health hospital, because it seems people have either squandered that money, or for some reason or another, they don't want to pay these people. And my job is to ensure to say that these volunteers who have worked, they should be paid like anyone else. These people have lost, some of them have been evicted from their homes, some of them are going hungry, some of them have done so much work such that some of them were even beaten by dogs and insulted by the public that they were working for.
Management at the hospital has, however, been citing bureaucratic procedures as the cause in the delayments, but the workers say they will no longer take such reasons, calling on the Ministry of Health to take interest in the matter. Zipporah Mshala.